Good afternoon. Thank you for joining us here today for our update from Erie County on September 2nd. Before we go into COVID things, I have a few comments to make. First off, of course, we're joined by Kendra Schmidt from Deaf Access Services, who will be providing the American Sign Language today, as well as Dr. Burstein when we go through the COVID items. I did want to talk about the incidences that we've seen recently over the weekend, as well as yesterday in North Buffalo on Hurdle Avenue. As someone who lives in North Buffalo, and I jokingly refer to my house as the North Buffalo Command Center, it was very distressing to see incidents of racial unrest in our community. I want to commend the Buffalo Police Department for arresting the individual who was threatening people with a knife, an individual who is not a resident of Erie County. I also want to commend the individuals who came forth to actually complain about the incident, who were not protesters, but were just bystanders or people who happened to be driving by and saw actually the knife in his hand. How do I know that's happened? Because some of those people reached out to me. And I said that you need to do is you need to contact the Buffalo Police and file a complaint. And they did that. And I believe it's one of the reasons why those charges have been alleged against the individual, and the arrest was made from the individual from Franklinville with regards to the knife that he was holding during the incident, during what was otherwise a peaceful Black Lives Matter protest. And then, of course, yesterday there was the incident that occurred in front of Empty Pockets Bar and Restaurant on Hurdle Avenue. We have to, as a community, always stand up and say no to those racists and bigots who try to make it appear like they represent our community, our society, and they do not. No one will deny that there are not racists and bigots out there, because there are. And unfortunately, they live in our community, just like they live in every community across the United States. But the one thing I actually am very proud of our community is how we come together in those situations and say we will not tolerate that in our community. And that is exactly what happened after the video started coming out yesterday with regards to some of the statements that were being made by individuals in front of that bar and establishment. It is inappropriate, it is unacceptable, and we have to stand up to it as a community and say, not in our community, not on our watch. And that's what I think most of the people of this community have done. Now, with regards to the individual establishment itself, our Department of Health inspectors were out there earlier, but the establishment was closed. They have left notice on the door of the establishment with recommendations, including actions that need to be taken. Empty Pockets itself was previously cited by the Department of Health on June 30th for failure to have the employees as well as patrons wear masks during this COVID-19 environment. As such, the recommendation was for closure until such time as the ownership could prepare a remediation plan to address what were obviously issues back on June 30th. There were other inspections that had been performed, spot inspections, in which they passed it in July. But it's quite apparent after the incident in the video yesterday, there were people on the establishment's premises under their tent, under their awning, that were not wearing masks, that were not socially distant, were not following the proper guidelines. And as such, the recommendation is to close the facility. They have not had an opportunity to actually talk directly with the ownership individuals, whether it's one or multiple. But the place is to be closed until such time as the owner can come up with a remediation plan which is acceptable to the Department of Health, because it is unfortunately not the first incident of failure to follow proper COVID-19 bar and restaurant guidelines. As I noted, on June 30th, an inspection was completed by the Department of Health there. They were cited for failure to wear masks, failure to follow proper COVID-19 guidelines. They had done that afterwards. Unfortunately, of course, as we saw, it didn't happen yesterday. I think we as a community understand the issues that are going on in our country. It is a very, very divisive time in our country, especially with an election just a couple months away. But we need to come together and say that we will never allow and never stand for and never tolerate racists and bigots trying to define who our community is. The individual who came in from Franklinville saying he was protecting his neighborhood, well, the last time I checked, Franklinville's not even in Erie County. It's 50 miles away. So if this is his neighborhood, that's a long drive every day to protect your neighborhood if you live in Franklinville. We will not be defined by others who come in to say what they believe is appropriate, but we know is not. And the words that were said yesterday by individuals on the side of the street are unacceptable, can never be tolerated, and we as a community must stand up, and I'm glad to say the vast majority of this community has stood up and said that is unacceptable. This is not who we are in Buffalo. This is not who we are in Erie County. We are better than that. And I want to thank all those individuals who did that. We have received more than 100 complaints with regards to empty pockets in the issue yesterday. There's no reason to file any more complaints. We have enough. As we said, the Department of Health has taken action. And hopefully the owner will understand, or owners will understand, that in today's day and age, in a COVID-19 environment, we need to protect our public, especially when we've been seeing lately what we'll be talking about in the next few moments, which are increasing numbers of cases, especially in the age range of those who often go to bars, 20 to 29, 30 to 39. So with that, I'll be taking questions on that later, but let's go straight into the rest of the COVID-19 update. There you go. Almost there. Okay. So, as of yesterday, we're 9,752 total positive cases out of 330,000. Actually, a little less than 331,000 specimens that have been tested. Those are individuals. 681 people have died. We offer our deepest condolences, of course, to the family and loved ones of those who unfortunately have perished from COVID-19. There were 3 more deaths that were added as of late yesterday. I announced it earlier today, dating back to the end of last week. These are all lab-confirmed cases of COVID-19 before the individuals perished. We've talked about this repeatedly for some months now, but there are still folks out there saying these were presumed positive cases. You really don't know if they had COVID-19. We know they had COVID-19 because they had a positive COVID-19 test before their death. On August 31st, there were 26 individuals admitted to Erie County hospitals. 6 individuals are in the ICU, and of those 6 individuals in the ICU, 3 had an airway assist. And you see the chart on the screen. The total hospitalizations have basically stayed in the 20s since August 4th, so we've almost had a whole month of basically no more than the mid-20s on an average day. But these are not the same people. I think it's important to note that. These are people who are coming in and out, sometimes there for maybe a week, sometimes only a few days. But these are not the same individuals. We've heard that in an occasional situation, like, well, the people who are in the hospital have been there for months. This is not the case. Every day individuals are released, and every day new ones are admitted. And we want people to understand that COVID-19 is in our community, and people are catching COVID-19 now that did not have it before, and there are people who are being hospitalized now who may have been COVID-free just a couple weeks ago. So it's important that the public understand that COVID-19 is still in the community, and people are still getting sick, and as unfortunately I just recently noted, people are still dying from COVID-19. Hospitalization data for Western New York, there were 34 people hospitalized in Western New York, 7 in the ICU. Considering we had 26 in Erie County, so that just tells us that there were 8 other individuals across Western New York who are in a hospital in one of the other counties. So it's not just Erie County that COVID-19 is at and people are being hospitalized at. So I want people to understand that. The cases by age and gender, we've been talking about this for quite some time now. It has shown growth in the age of 20 to 29. For the longest time, generally cases seem to be in the older age categories, though it was pretty even across age categories, not so much anymore. We're seeing growth in younger age categories, including children, as well as now the 2 top age categories are 20 to 29 and 30 to 39. These are generally individuals who are working, so they may be catching it at work, but they also be catching it going to bars, going to restaurants, going out. And so we want people to understand just because you are young does not mean you are invulnerable. And just to note that, of the 26 individuals who are in hospital as of the 31st of August, I believe 5 of them are under the age of 44. So there are people in the hospital as of just a couple days ago who were in their 20s, 30s, and early 40s. So just because you're younger doesn't mean you can't get sick from COVID-19. Why don't I turn it over to Dr. Burstein to go through some of these other things to talk about ages and percentages, because these is all related to the data the Department of Health provides. With that, let me put my mask back on, which is a special from the U.S. Census Bureau, Get Counted, because we want everyone to get counted for the census, and I'll talk a little bit more about that later.
Thanks. Good afternoon. So just going through the numbers. So this is looking at the proportion of positive tests by age for COVID-19. So you can see that we're still very concerned about people in their 20s. They constitute the highest proportion of positive tests. About almost a quarter of all the people that tested positive for COVID-19 last week were in their 20s. Also just want to note that we're seeing more young people between the ages of 0 and 19 that are testing positive. In the past, it's always been around 5%, somewhere around that. This week, it's 16.2%. But however, we're also seeing more people in that age group being tested. So this is another way looking at the positivity rates by age. So again, you can see that among people in their 20s who were tested for COVID-19, and that's almost 4,100 individuals in their 20s, 79 were positive, so that's 1.9% were positive. And so you can see that that is the greatest, highest positivity rate. Except for the people between 0 and 19. However, you can note that the young people between 0 and 19, there were less than half the number of tests done in that age group, and that's a span of almost 20 years compared to the other age groups. So again, I think these are really what we're seeing are the younger people are coming in and getting tested because they're ill, whereas I think a lot of the older people are coming in getting tested for many different reasons. But again, we are seeing college students returning, and freshmen are usually 17, 18 years old. And so, people are thinking about, I think at least one school district has, the K through 12 has opened up already, I think Alden. So again, I think that'll spur more young people to get tested in the near future. So again, looking at the gender and the residences of the people who tested positive for COVID-19, you can see it still persists where a slightly higher proportion of females are testing positive compared to males. And then of residences, there is still a disparity, whereas about 28% of our population in Erie County lives in the city of Buffalo. It's almost 50% of the people who are COVID-19 positive have lived in the city of Buffalo. So again, I think that we can look at that as one of the social determinants of health and looking at health disparities and access to housing. And so this is giving us the big picture of the proportion of positive tests for COVID-19 since we started looking at the end of March. So you can see, again, the two main messages is looking at the bars. This correspond to the number of specimens tested each week, and in blue, and then the confirmed positive cases among those tested in yellow is that we are testing more people every week. Over 20,000 tests are being done in Erie County every week, and each week we still persisted with a proportion of positive tests below 2%. So this past week we were 1.5%. We had some days that were a little bit higher, and obviously some days that were a little bit lower, and that's how you get an average. So again, we are still under 2% for last week. And then just overall, this is looking at the proportion of positive tests. The number of specimens tested and the confirmed cases over the past 6 weeks. So, again, we've been kind of holding steady between 1.1% and 1.5% where we are this week. And then we are also still receiving antibody tests in Erie County, and so this is looking at our antibody test results in Erie County over the past 6 weeks. And so last week, you can see that we've had much fewer number of people being interested in testing for antibodies. We had less than 1,000 antibody test results received last week. However, the proportion of positive results were higher, so I'm not really sure if that's really because less because people were tested. However, the message still stands. Most of the people in Erie County have not been exposed. We still have a very high proportion of people in Erie County who are vulnerable, and even if people do have antibodies, we're not really sure what type of protection that is. So the data we showed you are COVID-19 still here. People are getting infected, and there are a lot of people that are still vulnerable to infection. These are unfortunately looking at our mortality data, which again is so sad. So this is looking at our mortality data by age and gender, where females are in yellow and males are in blue. Again, you can see that the vast majority of people who have died from COVID-19, those victims are seniors, especially people over the age of 20. So that still have to be very vigilant about protecting those individuals. And as the county executive mentioned, we had 3 deaths recently. So again, looking at our demographics of our people who had died of COVID-19, and comparing that to our Erie County demographics. So again, we are on target with in terms of eliminating disparities in terms of residences. So we know that among people that live in Erie County, about 28% live in the city of Buffalo. And we have about 25% of our COVID-19 victims who lived in the city of Buffalo. So again, that's not much of a disparity there. And then looking at the lower graph or lower table, looking at the race ethnicities of people that live in Erie County and comparing that to our COVID-19 victims, you can see that still about 80% of Erie County residents are classified as white, about 15% are classified as black, and of our Erie County mortality victims, about 80% are classified as white and about 16% are classified as black. So again, we are trying really hard, working with our community partners, and they've been amazing, our healthcare providers and our community organizations, to make sure that people who are vulnerable to COVID-19 stay well as possible. Do you want to take this? I'll turn over to our county executive. Thanks.
Thank you, Doctor. You may remember we were doing comparisons early on to other regional centers in our region. When I talk about Erie County, New York, we're talking, of course, about the city of Buffalo. When we talk about Allegheny County, Pennsylvania, we're talking about Pittsburgh. And when we say Cuyahoga County, Ohio, we are talking about the Cleveland area. So these are the two other larger centers in the United States, not too far away, about 3 to 3.5 hour drive away. And if you remember, for the longest time, we had many more cases than both counties, substantially more cases. That is not the case anymore. As of the data today, you will see that we have 9,752 cases in Erie County. They have actually over 10,000 cases in Allegheny County, Pennsylvania, and they have over 15,000 cases in Cuyahoga County. And as a result, their actual death numbers have increased too. They hardly had any deaths, and now they've increased their deaths. When you look at it as a percentage of the total population, Cuyahoga County is a little bit is above us. About 1.3% of their population has contracted the coronavirus that they're aware of through tests. Ours is about 1%, and Allegheny County's is about 0.8%. I bring this up because for the longest time we were much higher than all of those. And they've seen growth in their cases as well as deaths in the last 2 months, where we've been able to control more of the cases and certainly control more of the deaths. So that's a good sign. It's not great that we still have these higher cases and the higher death total in general, but I am glad to see that we've at least reduced the spread of the coronavirus for our community and those who are contracting COVID-19 compared to what we were earlier, at least through June, and compared to the months of July and August, where there was a tremendous increase in cases in the Cleveland area and the Pittsburgh area, but not the same increase here. So I want to thank everyone for the good work to try to keep the caseload down, because for the longest time, our blue bar was much taller than the other 2 blue bars, and that's not a good thing when you think about the size of our community and their communities and the percentage of what a population that was contracting the coronavirus. So this is at least a good sign for our region compared to where we were. Now, colleges, testing results. The Erie County Department of Health is working with area educational institutions regarding positive tests of students. I've spoken to President Satish Tripathi of the University of Buffalo about cases at the University of Buffalo or among University of Buffalo students. We can now definitively say, because most of these cases were basically recorded in the last 3 days. So a lot of the data that we talked about with regards to last week did not include the data that now is showing this growth of cases at area colleges. That will be included in the final statistics for the upcoming week. But our contact tracing indicates that a majority of the students who tested positive were sick when tested. That's why they got tested, because they were sick. They were questioning, wonder if I got the coronavirus. A lot of them do. They lived off campus, so they were not living in dorms, but they were living off campus. Whether it be the University of Buffalo by the Amherst campus and off-campus facilities there, or in the University Heights district, or Buffalo State, which has reported a number of cases. And here's the thing that we really need to put out there. They attended house parties. So, if you're a college student, whether it's University of Buffalo, Buff State, or for that matter, Canisius College, Duville, Damon, if you attended a house party in the last week, you should get tested, because what we are fearful of is that the students who got tested were primarily sick. They were not asymptomatic. They were not feeling well. We believe there's a number of college students who attended house parties in the last week who may be asymptomatic with COVID-19. They're not sick. They might feel sick in a few days, but right now they're not. But if you attended a house party in the last week in the UB, Buff State, Canisius, Damon, Duville, where there's dorms generally, and they have students that travel from outside the area to live in off-campus housing, you should get tested, because there's a chance you were exposed to the coronavirus and COVID-19, because we do know from our contact tracing that students who have tested positive went to get tested because they were sick, and a number of them said, yes, I was at house parties. Our contact tracers not only talking to those individuals, but they've contacted individuals that we've been made aware of by the students who were sick, of others they may have come in contact with. And those individuals are, of course, following the protocols that are in place with regards to potentially getting tested themselves, as well as monitoring their health. But we did want to put that out there. I have, as I said, talked to President Satish Tripathi of UB. He is very concerned, as I would assume all of the educational leaders are. None of them want to be in a situation like Oneonta, SUNY Oneonta, which was shut down. We knew that there were going to be cases associated with college students. The question was how many. We're starting to get them in now. And we just want the people to understand that coronavirus is still out there, and you can be in your 20s and you can get sick. You might not get hospitalized, but you can get sick. You get flu-like symptoms. We've talked about the symptoms before: fever, the cough that can exist, the trouble breathing. We haven't really talked about it recently, about what the symptoms are, but they don't seem that different often from the common cold, or for that matter, the flu. But if you're feeling that right now, considering we really don't have any flu in this area, you might have the coronavirus, especially if you're a college student who went to a house party in the last week. Now, with regards to future house parties, I do know the Department of Health is working with our Department of Homeland Security and Emergency Services, with Buffalo PD and the Erie County Sheriff's Office. If we get reports of house parties that are violating the COVID-19 protocols, if they have more than 50 people there, they will be shut down. I want to thank our partners in law enforcement for doing that. It's just like any non-essential function that violates the rules, it will be shut down. And if I was a college student, you're probably thinking, hey, first week back on campus, I don't even need to go to class because most of them are virtual. I'll go to the parties. Don't. You're probably going to put yourself at risk. And oh, by the way, if we get reports of these large parties going on off campus, and we go there and find out that they're violating the rules, we're going to shut them down. And you could be cited with a violation. So, be careful. Testing, I'll turn it back over to the doctor to talk about testing, which fits in perfect because, Cindy, we're talking about students who may have attended a party and they should get tested. Well, here's the information to get tested for free by Erie County. Put my mask back on. My Census mask, it counted.
Thank you. Thank you. So, so our county executive alluded that we are still offering free testing, both diagnostic testing, the nasal swab, and the antibody testing. So for both, you can call 716-858-2929 to schedule. We also have online scheduling just for the antibody tested, not for the diagnostic testing. So remember, this is free. There is no cost to people that are getting tested. You don't need any type of physician's order or lab requisition. These are we are doing the tests at the clinics that we host at the Erie County Health Department, and these are by appointment only. So we are turning away walk-ins for the diagnostic testing, for the swab testing. For the antibody testing, we're letting walk-ins in. We welcome walk-ins, but for the swab testing, the diagnostic testing, we have to turn them away because our diagnostic testing is very, very full, and we have a limit of number of tests that we can do in our public health lab. So if you have an appointment, please show up. And we have sites all over Erie County. So we have a site that is very close to the UB North campus on Mondays, and a site in Orchard Park near ECC on Wednesdays. And then in Buffalo, that is also convenient for college students that go to this, who live in the city of Buffalo, on Thursdays. So we are really trying to make it convenient for everybody to get tested. We have antibody testing sites throughout the county, throughout the month. So coming up, we're going to be in Cheektowaga, in Amherst, in Lancaster, and then in Newstead. So if you want to get tested, see if you could have been exposed, we welcome you to stop by or call and make an appointment. And if none of those are convenient for you, we do have our Erie County Interactive COVID-19 Test Site Map. So if you click on one of the dots or the stars, you'll get a little box pop up of information about those testing sites and whether you need to make an appointment or not, whether you need insurance or not, and pharmacies are included in that. So now we can talk about how Erie County responds, and I will turn it over to our county executive.
Thank you, Dr. Burstein. As you know, we've talked about CARES Act funding and what county is doing to assist municipalities as well as school districts and charter schools address the need for protecting their students, protecting their staff if they're returning to school, or for that matter, virtual learning. We have pledged over $15.2 million in total funding to schools to assist them with regards to PPE acquisition, sanitizing equipment, remote learning technology costs, which there are many. I can state as of today, $884,850 is going to be paid this week to 3 districts: Amherst, Cheektowaga, Sloan, and Hamburg. The remaining school districts are under contract for payment, and payment will be coming soon. All but 3 public charter schools are under contract for payment. And those have been contacted. If they're not interested in it, so be it. But all public schools have signed contracts with Erie County. We're expecting a little less than $1 million to go out the door this week, and then other money will flow to those school districts to assist them based on the formula that we have in place. I want to thank the school districts, including the superintendents, for working with us to address this and to resolve it as quickly as possible with regards to the funding. I feel very confident after conversations I had with school districts and the representatives of Erie 1 and Erie 2 BOCES that this money is going to be appropriately utilized. All the school districts know that if they don't, it is subject to recapture. So I believe we will be seeing all this money utilized for the purposes that it's supposed to, which is to protect staff, students, if they are doing in-class attendance, or for that matter being used to purchase laptops and things like that for virtual learning. And I'm glad to say that that's moving along well. Child care assistance and programs. We talked about last week how we're going to announce major initiatives with regards to childcare. Well, the big announcement's coming tomorrow. You see lots of happy kids in that slide there. I don't know if they're necessarily happy because they're going back to school, but for some of them, they're not leaving the house to do it. But their parents have a big issue with regards to childcare. If they have to work, but their child is not going to school because the school is doing virtual learning. So we're going to have a big announcement coming tomorrow with regards to 3 initiatives that we will be funding out of the CARES Act to provide child care assistance for our community. The Joint Travel Advisory is still into effect. A number of states had been taken off recently. The District of Columbia was taken off a little more than a week ago. But then there were 2 other states that were recently put on again. So if you are traveling to a state that's red, of course, you have to quarantine for 2 weeks after your return to our region. It is good to see the Northeast region, and truthfully, most of the Great Lakes now are now in the white, so to speak. They're not in the quarantine. So if you have family that you wanted to visit in Ohio, you can go visit them now, and you don't have to quarantine. So that's good. It also shows where the hotspots are in the country, and it's continued. The hotspots are in the South, the Midwest, and the West. So just remember that if you do travel, you have to quarantine. And this is a big one. You can also file a complaint of traveler form on our website. The link is there, erie.gov/COVID19/travel form. We've had more than 1,000, 2,000? 1,300. From the airport alone, from people that we're having to keep track of. And I'm glad to say I know some people who've traveled to some of those states and have quarantined. We've also gotten reports from others who've been traveling and haven't quarantined. We do check on those to confirm that, first off, the state or where they were going, if it's like the Commonwealth, like Puerto Rico, is on the list or not. Puerto Rico is on the list right now. So then we confirm that did they then come back in and should have quarantined or not. We are doing that. It's all part of the work that our Department of Health does, which right now is a lot of work. COVID-related complaints. Of course, you can complain about a lot of things. We don't always have to listen to those complaints, but there are certain complaints that we have to take, and those are complaints about restaurants, bars, and gyms. The Erie County Department of Health does have a complaint line. You can call 961-6800 to file a complaint against a bar, restaurant, gym, or other entity that is under the auspices of the COVID-19 restrictions if you feel that they're not following the rules. We received more than 100 of those just in the last 24 hours with regards to Empty Pockets, the establishment we talked about before, but we are still getting complaints about other establishments, and we go out and check on it. Often, we find out about a violation, or we will write up an entity because of a complaint that we've received either on the phone number or on a complaint line that you can find on our health department website, which you can find, of course, at erie.gov/health. We are receiving fewer complaints than we had, which is probably good. That means establishments are following the rules, but we still get them. And then if you have complaints about other types of businesses, locations, you should call the New York Pause hotline at 1-833-789-0470, or you can also talk to your municipal building inspector. They have the power if they're violating issues associated with occupancy, not wearing masks where they're supposed to be wearing masks. Your municipal building inspector also could fine them or shut them down. And then finally, before we take questions, I once again want to remind everybody, as I have my special U.S. Census mask here, that the census is ongoing. There's one more month. Normally it would have gone through October, but now because of an order from the federal government, Trump administration, the census will end at the end of September. And it is hugely important. Many programs funding that we receive from the federal government, almost all of them, I should say, are based on the population. They don't necessarily treat an area better than another area, but if you qualify and you get a grant, it's going to be based on your population, and includes road funding. So if we do not count our community correctly, we are throwing millions and millions, truthfully hundreds of millions of dollars out the door over a 10-year period. We also lose representation in Congress, because Congress, the congressional districts, are based on the size of the population. So if we are accurately counted and we are where we think we are, which is actually a greater population than we were in 2010, that will help us with funding as well as our congressional representation. So it's essential to everyone to respond to the census. If you have not done so, you can do so online at census.gov. We know the enumerators from the Census Bureau are walking around our community. If they come to your door and they knock on your door and they say, I'm from the U.S. Census, we do not have a response from you, we'd like to take your response, please answer, don't hide. It actually hurts our community. It hurts your town. If you live in one of the southern towns and they are not counted accurately because people do not respond to the census, it will hurt your town with regards to funding, including on roads, which I know a lot of people care about in the southern part of our county. Please respond to the census. We have one more month. You're going to hear me say this until it's over with, but it's that important. It matters for our congressional representation, and it matters for the funding that we receive from the federal government on so many programs, not just road funding, senior services, social services, mental health, addiction services, environment and planning issues with regards to proper planning, issues associated with soil and water conservation. Population matters for those programs, and that's why we got to be properly counted. With that, I will entertain questions. Jeff,
so with these off-campus students that are causing some of these issues, and Buff State has spoke to yesterday said that they're trying their best to police it, but what happens if this continues for a week or 2 weeks or 3 weeks and there's no change for the students?
The question was, what happens if there's no change with regards to the students getting sick from off-campus housing, or they live off-campus? What could happen? And how Buffalo State College is trying to police it? Well, a number of things can happen. If it's associated with a sorority or fraternity house, they can be shut down. They can be shut down by the college, and theoretically it could be shut down by the county if we believe they're at risk. If it's individuals that are just in an apartment or so forth, they're not necessarily going to shut down an apartment, but my understanding is the students could be suspended from school for failure to follow proper protocols, especially if they get sick and they go to other areas and putting people at risk. It's incumbent upon the higher institutions, the colleges and universities, to enforce these rules that they have. If they're a SUNY school, they had to have a dashboard. I think all the SUNY schools have a dashboard. They've got to put them in place, identifying the number of students and faculty and other administrative and work staff who've tested positive for COVID-19. But then they also have to take that next step. My conversation with Dr. Tripathi, president of UB, he was like, I don't want to see what's happening elsewhere, where we have these huge numbers and then the school just gets completely shut down and goes 100% to virtual learning, which there are still labs that are going on campus. There are certain things that have to go on campus. Other classes can be taught virtually. Nobody wants to go to 100% virtual. They understand that that is not a good way to educate students in a college setting. So I believe they are taking it very seriously. And we'll take it seriously as well. As we noted, the Department of Health, our Homeland Security Emergency Services Department, is working with local law enforcement to address issues associated with potential large house parties that are putting people at risk. I mean, I went to the University of Buffalo. And when you went to the University of Buffalo, at least in the late 80s, there was no real Amherst scene back then. You went to the University District. And you went to PJ Bottoms and First Bay, or Third Base, whatever it was, Third Base, yeah. The bars like that, the Steer. But you also went to house parties on Minnesota and things like that. That's the problem, is those parties, no one's wearing masks, of course, and they can get very large, and they're exposing a very large subset of our college population, and that can then spread it on to everyone else. So the universities and the colleges are taking it seriously. They do not want to see themselves get shut down, and that is a possibility because we've seen SUNY already shut down SUNY Oneonta. We've seen them take action against students elsewhere, and if it continues, they're going to take action locally. Students could be suspended. For fraternities and sororities could be suspended and theoretically disbanded. I don't think any fraternity or sorority wants to risk losing their affiliation because of something where they held a huge party and people got sick. Michael?
Mark, there seems to be this attitude that we know students won't behave stupidly like college students have been behaving for 1,000 years. And everybody's saying they just won't do that when they come back this week, next week. I mean, it's unrealistic. Everybody knew students were going to do all the stupid things college students do, and everybody's saying, oh, it's awful.
I don't know if that's a question as much of a comment, but the question and comment was from Michael over here, and he was talking about students when he went to college many years ago, and how they acted stupid back then, and they act stupid today. And I'm not going under the pretense that students are going to follow all the parameters and wear masks and not socially distant. I know that's not the case, and that's why we are working with the schools to not only monitor this, to be the contact tracers communicating with students. If a student is refusing to work with our contact tracer, we are working with the schools, and we are telling the schools to take appropriate action for that student. This will not be tolerated. If a student thinks, hey, I got sick, I don't need to tell anybody what happened, well, you know what? You should be suspended. You should be penalized and punished because you're putting the community at risk. I was a college student years ago. First 2 years of college, I spent more time having fun, playing in the pool in the student activity center, or video games, or going golfing with my buddies at Grover Cleveland or Audubon than I should have been in the classroom. Yeah, I get it, but we also have to protect our public. And so schools need to act appropriately to ensure that our public is protected, their school is protected. They want to protect the other students, they want to protect their faculty, they want to protect their staff. Same issues we're going to be dealing with regards to the public and private schools that are reopening. Some of them full in-person learning, others are not, of course. This actually, the best way to describe it is we've been anticipating this issue for a while now. I told my department heads and senior staff, if you got vacation coming, you better take it before Labor Day. Because after Labor Day, I have a bad feeling about what could happen in the community as caseloads go up, as community spread continues. And thankfully, it appears most of the department heads and senior staff have taken their vacation time in the last couple months when it's been a lot quieter, because I'm fearful that the next few months will not be quieter. Allie?
So Jeremy Zellner, the Erie County Chair for the Dems, he said that the committee will no longer be accepting donations from the owners of empty pockets. They've donated to you. You've held fundraisers there like most Dems who live in North Buffalo. Are you prepared to do the same and not accept donations from them? And I guess
Well, we'll not be holding fundraisers or donations. I don't believe all of the statements that have been attributed to that were horrible were attributed to the owners of Empty Pockets, but it's an unfortunate situation, and there were individuals there that should not have been there, and that's not a place that we're going to frequent or establish, or establishment that will be holding fundraisers or accepting any dollars. I don't think I've accepted dollars from the one owner in years, but that's just how it goes. I've rejected funding in the past from other individuals that were directly associated with racist statements. I would look at it this way: it was an unfortunate incident. I have not talked to the one owner. I've not talked to any of the owners. I think there's 2 owners is what I've been told. I've not talked to any of the owners. I have talked to someone who's close to the owner and said that the owner is very remorseful and understands that this was inappropriate. Hopefully he'll be issuing a statement noting that to the public. I think it's important that he does, and that they do as an ownership group. I understand that when you own an establishment, you can't necessarily be held accountable for every person there. You don't know who's always there. It's when you open up a bar or restaurant, people walk in, you don't know what you're always going to get. But what happened yesterday was just unconscionable. The words that were being said by some of those individuals on the side of the street towards the protesters is, I just didn't think you'd hear in public anymore. But unfortunately, we live in a day and age where people feel emboldened to say what they're thinking. It's not good, but at least we're seeing who the racists and bigots are in our community. They used to hide behind white sheets a long time ago. Now they just do it publicly. They do it on their Facebook pages. They do it on Twitter. I recently noted, on Facebook, I've got a lot of Facebook friends, including people I don't know who they are, but they friended me over the years. I'm like, okay, I'll accept their friend request. And then you see some posts afterwards, and you're like, I don't want to be associated with these people, and you defriend them, unfriend them. I've done that recently after seeing some posts from some individuals with regards to the issue in Kenosha, where they were making a meme with regards to the death of the protester. I would not have fathomed that. Maybe I'm naive to a point to think that that wouldn't have happened in the past. I guess maybe people just, they existed. We knew racists and bigots existed, but I didn't think it would be as open and public as it is today. And it's not going to be a pretty few months as we get closer to the election. I think it's going to get nastier in some ways, but that does not make it tolerable. We must stand up to it and say, this is not acceptable in our community. Leanne?
This may be a better question for Dr. Burstein. New York State came out today saying that Erie County is in need of more contact tracers. What is the current state of contact tracers here in Erie County? How many more do you need? Why is the need there?
Well, I don't know why New York State would have said that. I'll let Doc talk about it as well, because we have a sizable amount and we're hiring more. We actually just advertised for more contact tracers. I'll say this, we've heard some statements recently from New York State, and they have not told us that directly. They're just going out and saying it, which I find a little disappointing, because I'd like to know what their critique is before they say it. If there's something that they feel that we need to do, we're doing it. But we also are relying partially in some ways on New York State's contact tracers. But we've advertised recently for hiring of more sanitarians and contact tracers. We have more responsibility that's been put on us by New York State, but they're not paying for it, which is the usual. We can pay for that through the CARES Act funding through December 30th. We're still going to need these contact tracers and sanitarians afterwards to enforce the rules, and we're going to have to pay for it on our own when we're facing a very sizable deficit. But I'm not aware of any comments directly. I'm on the calls with the Lieutenant Governor and others saying you need more contact tracers. I've not heard that, but we are hiring more because of the work that we're dealing with, and I'll let the doc also respond.
How many more are you hiring? Do you know how many more you need?
Thanks. So the question about contact tracers. So we actually, I think, have received over 600 applications for our contact tracing open positions. We are hiring additional contact tracers. We anticipate, as we've been stating throughout this press event, that we are going to see increasing number of COVID positive cases with the schools opening up. I mean, just in the past couple days, we've had these new reports of college students with K through grades 12 opening up. We're going to see more kids being tested and more positive test results in that age group. So we are, and public health is preparing. So we are preparing and hiring more contact tracers. So hopefully by the end of the month, we'll have more people in place and be able to expand what we're doing. Currently, with the number of contact tracers that we have, and we have somewhere around 50, we are able to get the work done. It's not all 50 work at one day. We usually have between 30 and 40 working in a day. They are very busy. They are working the entire 8-hour shift. However, they are getting through the cases and identifying contacts and getting and notifying the contacts and getting through that work. So with the current body of contact tracers we have now, and an end of an 8-hour shift, we are getting through that work. However, we anticipate that the work will expand, so we are expanding the number of contact tracers. And as we noted earlier, people are still traveling to these high-risk states, and we're finding positives from that. People are going to bars and restaurants and may not be wearing masks, and we're finding people who report that behavior. We're finding just in the past couple days a lot of college students who are infected and going to these house parties that are not masking. So people are still engaging in these behaviors, and COVID-19 is still here, and unfortunately we anticipate seeing a higher number. And so fortunately, through the since we have so many applicants, we will hire a certain number, and if we need to hire more, we have this great pool of potential applicants, and we can hire more. And then if we don't, if someday if we have a vaccine and we are able to get community herd immunity and see a small number of cases, these are going to be contractors that we're hiring. So then we can end that contract. So again, we're trying to be flexible and be able to expand and contract as our needs expand and contract. Yes.
What can you say about the factors that might be leading to Western New York as a region still being nearly twice as high an infection rate as the state average?
So the question is, why do we think that we are, in Western New York, we're seeing higher numbers and higher proportion of positive tests than other parts of the state? Again, well, first of all, we are testing more. We have great testing capacity in our area. And we, people, we know how COVID-19 gets transmitted, right? It's through, a large number of people in close contact, not wearing masks, not socially distancing. So, apparently, people are traveling to states that have even higher numbers than we have. So, people are still engaging in those behaviors, and we are so fortunate. We've sacrificed so much to get down to the low percentage that we've had so far. But unfortunately, so far this week, and just a couple of days this week, we've had about almost a 2% positivity rate. So, again, COVID-19 is still here, and people have to continue to socially distance. Stay in small groups, don't go to bars, don't go to restaurants where there are a large number of people aren't masking. There's personal responsibility. Again, we say we're all in this together, but we are all in this together. We all have to engage in these preventive behaviors to keep our community healthy. If we don't, we're going to continue to see these numbers, and we could even go higher now that schools are opening up. So we have to continue to be really, really careful. Yes.
When the state started rolling out New York Forward, I know that there were some concerns that when we got to each phase, if our numbers started going back up, we would roll back a phase. Is there still concerns that certain activities could be shut down by the state if we are still seeing an increase?
Sure. Do you want to take that?
The question was in regards to, is it possible the state could roll back some of the activities that they're allowing now under the New York Forward plan due to the increased cases? And the answer is yes. One of the reasons I believe the state brought in the rapid testing SWAT team, so to speak, was to get a better understanding of how many people really have positive cases here. And they are very worried, and I'm worried, and I've been saying this for quite some time now, that if we continue to grow with regards to the caseloads, that we put ourselves at risk to seeing shutdown of things that just reopened, like gyms and bowling centers, nevertheless the shutdown of indoor dining and bars. If you don't believe me, look at what happened in Pennsylvania. When Pennsylvania's numbers went very high, including in Pittsburgh. Remember how we talked about Pittsburgh, Allegheny County was much lower than ours, and now they're higher? Well, they actually shut down bars and indoor dining again after reopening them to stem the tide. And I do not want to see that happen here. It could happen. I know from the conversations I've had with other county leaders, whether it's Chautauqua County Executive P.J. Wendell or Rebecca Whittish, the Niagara County Chairwoman, and the individual ex-Earls and Kirk Crandall from Cattaraugus and Allegheny County, they're very afraid of it, but they're also seeing new cases in their communities. So none of us want to see the state do the ultimate, which is saying, you guys, you can't control yourselves, so we're shutting you down. That would devastate a lot of businesses that have already been severely hurt. If they had to shut down indoor dining or bars had to shut down again, I think a lot of them that are hanging by the edge on the precipice would probably close. And it's a reality, it could happen. And if people think it can't, just think about 1 year ago where you were today. You weren't thinking about COVID-19. You weren't thinking about the protests that we see in the country today. You're probably thinking about the next Bills game. But here we are today, and these are the issues that we deal with. I like to talk about, people say, when it's going to get back to normal, and I don't think there's going to be a normal that we're used to 2-3 years ago, but we're in a new normal today. And that means that if things got bad again, yes, bars would probably be shut down, and restaurants might lose indoor dining. And that's uncalled for. It's not needed, because we can control this. We should not be the highest region in New York State. And the only reason we are is because people are not taking it seriously anymore. I believe there's a percentage of the population, 25 to 30%, who basically said, the heck with it. Some who believe it's a hoax. It's not a hoax. I know people who've lost parents. I know people who've lost grandparents. I know people who've lost siblings. I know people who've lost in-laws. It's not a hoax. It's real. And it's not going away until we get a vaccine, as Dr. Burstein noted, or we develop herd immunity. And herd immunity requires the vast majority of the population to have been contracted. And we know, based on the numbers from our antibody testing, that we're only about 7% of the population has been exposed to the coronavirus. So the vast majority of us, including pretty much everyone in this room, I imagine, has not come in contact with the coronavirus. And you're still susceptible to COVID-19. And that goes for everyone else out there. And we need you to act appropriately. I do not want to see a shutdown. And if you want to go to a Bills game at Bills Stadium in October, we got to get our numbers down. And we only have ourselves to blame if we can't do it.
Mark, you mentioned PJ. Have you had any overspill from the ice cream plant?
The question was with regards to Chautauqua County and an outbreak there. I'm not aware of any. I think it was all basically in Chautauqua County. Have we seen that overspill here? It's possible, but I'm not aware of any in particular. Leanne?
This is bouncing off what you said earlier with area colleges in terms of college house parties and how people could potentially be cited for gathering. Does the same sort of complex work for people who are gathering in parks or gathering in basketball courts? I've been hearing from a lot of people about whether or not law enforcement is actually enforcing it with tickets or violations, or just using educational opportunities to just tell people to disperse. Can that sort of same idea be used for other scenarios?
The question is, if you see violations in other areas, not just house parties, but parks and sporting areas, basketball courts, and the kind where they're over the 50-person threshold, what can happen? And yes, they can be cited. Generally, it's broken up. I know in our parks, especially if you're shelter rental, we specifically have on the shelter rental now, if you have over more than 50 people, you will be asked to leave and you will lose your money, your deposit. I do know that park rangers and sheriff's deputies have spoken to individuals saying you have to break this up. Most people are very amenable, and we have not seen huge issues in our parks in the county. I can't speak for every town, village. A lot of people think every park in Erie County that's in the county itself is owned by Erie County, and that's not the case. We don't own, like the Buffalo Olmsted parks, those are City of Buffalo. Big parks in Amherst, Lancaster, those are the towns. So I can only speak on behalf of the ones that are owned by Erie County and our facilities, but we will break up anything that appears to be violating the standards, and if they refuse, then they would be cited.
I was going to say, have you given out any tickets or violations?
I don't know for certain. If there are any other questions? No other questions? I want to thank Kendra from Deaf Access Services for providing the American Sign Language. She's had the toughest job for the last hour. Thank you very much. And I want to remind everybody that we are not out of the woods yet. We still have COVID in our community. We, as a region, are the highest on average for the last 10 days to 2 weeks compared to all the regions in New York State. It shouldn't be like that, but it is. It is in our hands to address this. We have the power to do it. I want to see our numbers go down. I want to see where we were. We know that COVID's still going to be around until they get a vaccine, until we develop herd immunity, which I don't think we're going to develop herd immunity anytime soon, and I don't think we're going to get a vaccine until 2021 late, if that. So we need to do the proper things in the meantime. I hate announcing deaths. I hate finding out from someone that the death was a loved one. And I have found that out repeatedly since the beginning of the outbreak. Let's do better. Let's do the best that we can. Protect yourselves, be well, be safe, and wear your masks. And if you happen to see a census person go by and you haven't done the census, please do the census. It means a lot of money, congressional representation, and it will help our community in the long run.